It should be going. Yeah. Hello, viewers, and welcome to Pharma Health Talk. This is a live session with ADAKU EFURIBE, Dr. Abraham AMLOGU, and myself, George Orisile, the host and the convener for Pharma Health Talk. Right. So, and basically this afternoon, while we're looking at pharmacy perspective on building a healthy immune system using nutrition, drugs, and healthy lifestyles during COVID and beyond COVID. So with me this afternoon, two important guests, two clinical pharmacists, two professionals that I've known few years. They've got pharmacy practice experience, long years pharmacy experience. Thank you so much, Dr. Abraham AMLOGU, for coming in. Dr. AMLOGU is a clinical pharmacist and also a nutritionist, public health nutritionist in the UK. ADAKU EFURIBE is also a clinical pharmacist and an independent prescriber here in the UK. Thank you guys for joining this virtual session. Really appreciate this is the first time we're having this on Pharma Health Talk. And just a bit of background information about Pharma Health Talk. Pharma Health Talk is a social enterprise registered in England, and we promote health and to enable our community actually make healthy lifestyle choices and behaviors that will help them to take control and improve their health in order to minimize the risk of developing chronic diseases such as the non-communicable diseases, blood pressure, diabetes, cancer, where possible. So that is who we are. And this afternoon, we're actually going to be taking our guests through, very few important things, that, we're all probably familiar with nutrition, COVID, diet, lifestyle, and drugs. So the background information actually is that the Black, Asian, and minority ethnic BAME group was highly impacted by the coronavirus causing COVID-19, as reported by the UK government and in the media. Now, the coronavirus is a novel virus that causes severe respiratory syndrome, SARS-CoV-2, it is labeled, and which can cause COVID-19 disease, was first identified in Wuhan, China in December 2019. Now, there are evidences that have shown that infection is as a result of your exposure to an infective agent, such as viruses, such as bacteria, and such as this coronavirus infection. And what they do is to attack the person's immune system. Your defense system is attacked, and so then hell break loose. So there are scientific evidences also showing that nutrition and lifestyle interventions can contribute to improved resistance against viral infections and a reduced risk of a serious cause of the disease. Now, this afternoon, what we're looking at, the objectives of this health talk is to provide an awareness on nutrition, the concept of nutrition, the roles of nutrition in our immune system, and also to increase awareness on the relationship between nutrition and health with emphasis on COVID-19. And we also would like to promote healthy lifestyles that can help you and me build a healthy immune system. And we also want to look at increasing awareness on recognizing potential drugs or medication that can deplete some nutrients and affect your immune system. And also to appreciate the role of vitamins, supplements in sustaining a healthy immune system. So guys, now I said earlier on, I've got two important guests, Dr. Abraham AMLOGU, and also I've got ADAKU EFURIBE. So basically, I would like ADAKU to tell us about herself more, what she's done and what she's doing currently in the clinical pharmacy practice, and even during COVID, I experienced. So ADAKU will be taking us through what a brief bout. So ADAKU, welcome.
Thank you so much for having me today. I am ADAKU and I am a clinical pharmacist, and I am also an independent prescriber. So basically, I have a passion to build better healthcare systems, especially in countries like Nigeria and other sub-Saharan African countries. I also have a passion to make people live better lives and live longer and healthier lives through health promotion, healthy eating, exercise, and I also do long-term conditions review and medication reviews. So, and one other thing I do is to advocate with the United Nations Sustainable Development Goals. So I'm an advocate partner as well. And my goal is to ensure that we achieve goal 3, which is ensure healthy lives and promote well-being for all at all ages. And during this coronavirus pandemic, I've been involved in spreading information and helping to curb the spread of the virus through advocating in international TV stations like TVC and some other stations as well, TV stations as well. So I'm happy to be here today to learn more and to share information as well.
Thank you very much, ADAKU. You're welcome. Thank you so much.
Thank you.
Yeah, thank you. Dr. Abraham AMLOGU. Well, Dr. AMLOGU has been my wonderful friend. We were classmates in Ahmadu Bello University, Zaria. And of course, we were roommates at some point in our course of pharmacy profession. So Dr. AMLOGU, please, tell us a bit about yourself.
Yeah, thank you very much. Our host and friend, pharmacist George Orisile Abimbola, and also pharmacist ADAKU. Nice to meet you and our listeners. Again, just like the host mentioned, my name is Dr. Abraham AMLOGU. I'm a registered clinical pharmacist in Nigeria and a registered public health nutritionist in the UK. Over the years, I have been involved in the management of specific disease conditions using the tailored food recipe concepts in the management of specific disease condition. I am a fellow of the West African Postgraduate College of Pharmacists. I am also a fellow of the Public Health Nutrition Society, and also I have been participating actively in the coronavirus pandemic in ensuring the non-pharmaceutical usage of ingredients to promote patients' safety and management of this novel virus. This afternoon, I'm glad to be part of this program to share my experience and also to learn from my colleagues that are also experts in this field. From this our own point of view, and of course, we have been participating actively in the management of patients through either the pharmaceutical means or the non-pharmaceutical means. We have initiated the concept of the development of and the formulation of some formulations like the hand sanitizers, like the isopropyl alcohol 70%, and also the methylated spirits. And also we have also participated in promoting and providing specific information in terms of nutrition and how the COVID-19 patients can be managed with adequate nutrition. Thank you very much.
Thank you so much, Dr. Abraham. Yeah, good to have both of you here. So, yeah, so without much ado, we actually, like I said before, I've actually said that we're looking at an overview of COVID-19 and the impact on the Black and Asian community. So now I've got this fact sheet here published by the Public Health England 2020, talking about disparities in the risk and outcomes of COVID-19. And it says comorbidities. So comorbidities in the sense that you have other diseases present, together with COVID-19. So comorbidities among deaths with COVID-19 mentioned on the death certificate. A higher percentage mentioned diabetes, hypertensive diseases, chronic disease, chronic kidney disease, chronic obstructive pulmonary disease, and dementia all cause death certificates. Diabetes was mentioned on 21% of death certificates where COVID-19 was mentioned. And this finding is consistent with other studies that have reported a higher risk of death from COVID-19 among patients with diabetes. Now, this proportion was higher in all 8 BAME groups when compared to white ethnic groups and was 43% in Asian group and 45% in the Black group. Now, the same disparities were seen for hypertensive disease. Several studies, although measuring the different outcomes from COVID-19, report an increased risk of adverse outcomes in obese or morbidly obese people. So, guys, one of the salient things that I've picked from here is that non-communicable disease actually is a predisposing risk factor. Obesity is actually another risk factor. And that is why we put this thing together this afternoon, that the Black community, whether we like it or not, 45% in the Black group that studies were conducted on actually, died as a result of comorbidity, which was diabetes or hypertension. So, guys, what exactly, what is your overview? What is your, how would you describe COVID-19 and its impact, on maybe Nigeria perspective? I know Dr. AMLOGU would have seen, cases, and ADAKU here in the UK. So what is your general perception about COVID-19 as relating to Black, Asian, and minority ethnic group? ADAKU.
Okay, well, in the UK here, because we have more Black minority groups and Asian minority groups in the front line, doing some kind of work. We have more of them in the train stations. We have more of them as nurses, doctors, and pharmacists. So it's a little bit, they're more predisposed in a way because they face a lot of clients and customers, and some of them cannot work from home. Then, just like you said, other long-term conditions as well. We know that Afro-Caribbean ethnic people are at a higher risk of developing hypertension, heart disease, and strokes. So we already have that risk factor. And with coronavirus and with the kind of work we do more, the risk factor has even increased. So in the UK here, we've seen a lot of nurses getting coronavirus, Black, Asian minority nurses, and people that work in train stations. Even in community pharmacy, I've had a few colleagues, that had the virus, but luckily they're still alive today. So all these risks, when you add them together, there's a greater risk of getting the virus because of one's ethnicity.
Okay, so basically, I mean, looking at it, the Black community are faced, front-facing frontliners,
Yeah.
and also because of certain disease conditions, we are at more risk. And so the emphasis basically is for people to begin to take ownership of their health.
Yeah.
I mean, in doing all this, the bottom line is health is wealth. If you're not healthy, you can't actually even do any work. You can't go out, you can't do anything. So emphasis actually is to build on our immune system to be able to actually fight, some of these infectious diseases. Now, it's COVID-19 today. We actually don't know what we're going to have tomorrow or next year. Perhaps there's another one coming that we don't know. So, Dr. Abraham, what is it like? What has it been like since this pandemic?
Yeah, thank you very much, George. First and foremost, Nigeria is the most populous Black nation in the world.
Yep.
And of course, the impact of this novel virus is actually on the increase. Considering our population, which as it stands today is over 200 million, of course, when we talk in terms of percentage, that's to tell us that, of course, for example, if we said we have just like 1%, that, I mean, if you translate that, of course, you agree with me that it's not a small number. It's interesting to note that the general acceptance of this novel virus has been undulating in the sense that a lot of us in Nigeria is still yet to come to terms with the reality on ground that COVID-19 is actually a reality and it has come to stay for now. Based on this, of course, we've been seeing different results in terms of numbers based on different states. But again, apart from Lagos State and FCT, that of course we've been seeing that awareness and response. Of course, the number of persons being tested. So, and of course, we are seeing those numbers based on those that avail themselves for testing. Until we get to the point where we take ownership of our health and see the importance and the need for us to participate or to get ourselves available for this testing, the numbers will not be a true reflection of what the current situation in Nigeria is. It is also important for us to note that the impact of this novel virus transit between the economic impact, the social impact, and of course, economically, we know that it has affected, it has affected the world in general. Nigeria is not an exemption. Of course, we know that, of course, within this period, from the month of February till date, of course, we know that economically, these viruses are really impacted negatively on us in Nigeria. Socially, a lot of things that we do together, of course, going out for functions, weddings, churches, and so on and so forth, it has been affected seriously. Of course, marriages have been affected. Of course, you will understand that. There are, a lot of information out there talking about social distancing, talking about a non-drug method of prevention, and all this put together has really, scared some fraction of the population. Why some? The truth about it is that most part of the population are not even, they have not come to terms with this reality. We talk about the use of face masks. We talk about the use of, the use of hand sanitizer and hand washing. As we speak today, the percentage of those that are effectively using the face mask is on the decline. And the numbers have started increasing again. Some states have not even come to accept the reality of the fact that this virus exists. So until we engage in discussions, public enlightenment, information dissemination that will educate the common man, the man on the street, to come to understand the fact that this virus is not a China virus, as they claim. This virus, is a global pandemic disease that, of course, we all should put our hands on deck in ensuring that we do everything that is possible in reversing this pandemic disease. Thank you.
Yeah.
Thank you very much, Dr. Abraham. You've really actually captured a lot of things there. You've actually moved from how this has affected our health and how this obviously has affected us socially, the economic impact just this afternoon. And you will agree with me that England, as we speak, is on a total lockdown. We can only go out for essential services, or if you want to go shop, essential things. So realistically, this has come to stay, whether we like it or not. And from one of the things that the Prime Minister was saying this afternoon, Prime Minister Boris Johnson was saying this afternoon, is that vaccine may not even come until spring next year. So whether we like it or not, the only intervention that we have at the minute is actually non-pharmacological intervention, which is the three things that have been put in place: washing of hands, with soap and water, washing of hands, using hand sanitizers, using facial mask or face covering, and where possible, maintaining social distancing. So those are the main things that we have in place. And, like I said, we're going to live with it. It's come to live with us. So, and going forward, people need to actually holistically take their health, very, very seriously. This has taken lives. This has taken away loved ones. This has taken away, breadwinners. And obviously, as a black man, to be honest, as a black man, I want to put it that, looking at my health, I really, want my health to be, top notch. Yeah, say for example, they gave me a ring to come and do health test or my eye check on my birthday. A lot of people will say, "Oh, on my birthday," but I had to go do it because, without these simple things, you cannot even function. So thank you very much, guys. We'll move on to, some other things that we actually have to do this afternoon. Now, the basis of this, the basis of this is actually looking at how we can build a healthy immune system, using nutrition. So immune system, is a complex system and functions well with a combination of a balanced diet, a healthy lifestyle to fight infection and disease. The immune system protects against harmful microbes, certain diseases, recognizing viruses, bacteria, and taking immediate steps and actions to protect us. So, guys, how would you describe the immune system? Dr. Abraham, how in a layman's term, you know, for our audience to understand. Yeah. So go on, sir.
Yeah, thank you very much, George. First and foremost, when we say the immune system, in a simple term, we just call the immune system as the body defense mechanism. That's the body defense mechanism. What they do, they act in two ways. One, by recognizing the invaders or the antigen. And secondly, by responding to these antigens. So what in a layman's term I will call the soldiers in the body. Absolutely. They are body defense mechanism, whereby their activities are centered around recognizing the antigen and responding to the antigen. So when we say they recognize and respond, this is done in such a manner whereby they develop what we call an antibody against the antigen. Suffice to note that when we say antigen for those that are listening to us that are not in the medical line, they are just basically the bacteria, the fungi, the viruses, and those pathogens. We live in a community whereby we are in the midst of different kind of pathogens. And unless we allow unless the immune system functions very well to be able to fight against these external aggressors, let me use that word, which are called the antigens, unless the body system develop an antibody against these antigens, definitely the disease condition will continue to progress. So, in other words, what are we trying to say, or what should we understand by that? When we say immune system, they are basically all over the body, in specific tissues and organs and cells of the body. Yeah. So, and as they carry out their functions, of course, some of us, we have what we call the innate immunity. Some of us, some again, get immunity through what we call the adaptive immunity. Right. So for those that, for the innate immunity, they are basically the natural immunity that we are born with. So as you are born, of course, you have some level of immunity in your body. Then, to make reference to COVID-19 in specific terms, you understand that as we speak today, no, it has not been possible to develop a vaccine. And just like the oath mentioned, that is going to take, sometimes in 2021, before we can develop, the vaccine. Yeah. It is important to note that while this process is ongoing, what we are actually going to have is called adaptive immunity. Sure. That means we are going to be giving the antigen, that is the virus, into the host to develop an antibody against that antigen. Mm-hmm. And of course, studies have been going on and on this. And that is why we have been emphasizing on the preventive aspect of COVID-19. Yeah. Because no drug today, as of today, no vaccine as of today. So we must ensure that we develop our immune system to be able to fight this virus. Mm-hmm. Suffice to know that you may be in an environment where, there's a carrier of this virus. Mm-hmm. Of course, even if the social distance, the person is not wearing face mask, right? You don't get infected. It's because of your innate immune system. Okay. Because there is no there's no vaccine yet, so we cannot talk about adaptive. Mm-hmm. So it is because of your innate immune system that has developed that antibody against the antigen. So let me just allow us, maybe later on I can make more contribution on the immune system.
Thank you so much, Dr. Abraham. Yeah, that is quite explicit, and I hope our audience at home, people at home, are taking advantage of this opportunity. This is Pharma Health Talk live session with Dr. AMLOGU. Dr. AMLOGU is a pharmacist, a nutritionist of over 20 years experience. ADAKU EFURIBE is a clinical pharmacist and also an independent prescriber. Both of them have quite a considerable number of years of pharmacy practice experience. And I tell you guys, if you can share this, share it on your screen, share it on Facebook, let people come and have, what they would actually, obviously will have to be opening books without even understanding what this means. So we've given this to you live from Pharma Health Talk table. So ADAKU, immune system, Dr. Abraham has actually touched on some of the few things, about innate and acquired immunity, adaptive immunity. What is your perception, about immune system,
Well, it's just to say that we have two different kinds of immune system, just like Dr. AMLOGU has said. The innate one is the one we are born with, and we have immune cells, called phagocytes, and the adaptive immune system is what we develop as we are exposed to microbes or chemicals released by microbes. But with COVID-19 right now, most of us, we don't have any adaptive immune system to it. And sorry, we don't have any innate immune system against COVID-19 at the moment. And that is why prevention is very important. And that is why we must do all we can around that area, because if our immunity level is low, we wouldn't have that protection from outside invaders like bacteria, fungi, and toxins, and viruses as well. And another thing I wanted to add is that the immune system, we find the immune system in different parts of the body, like the bone marrow, the thyroid, the tonsils, the spleen, and the adenoids. So it's highly important that we understand that there is no vaccine, and to develop vaccines, we have to have the antibodies and all that. So we don't have the vaccine right now, and we don't have any medicine right now to treat COVID-19. So that is why it's highly important, again, that we can use preventive measures as much as we can, and that we can use food, supplements, and vitamins to build up our immunity.
Yeah, thank you so much, guys. You guys have actually, said quite a lot of things on immune system. So a healthy immune system will definitely be required to, attack and defeat any invading pathogens. So pathogens in this case, like coronavirus, like bacterial infection. So even bacterial infections such as even gonorrhea, such as so basically what happens is that so in the cells there's something that goes on to actually engulf. There's a process process that goes on in our system that we actually do not see. So when it's just like, don't know how to describe this, but basically your immune system is your defense mechanism. So when an invading bacteria or viruses is coming, this triggers kind of antibodies to match those invading bacteria or viruses. So guys, the reason why your immune system is very crucial is that is the only form of defense you have. So immune systems that are innate are your first line of defense. Say, for example, in allergies, you have, your maybe in allergies, you have your skin, you have, such protective barriers, you have your mucous membranes that actually act as protective mechanism, and this also help you to fight invading, agents. So thank you, guys. We'll move on because actually we've actually touched on these few things. We'll move on to healthy nutrition. Healthy nutrition. Now, nutrition has been linked to immunity, with malnourished individuals being at high risk of infections, some chronic disease such as diabetes, high blood pressure, cancer can lead to nutritional disorders as well. A healthy diet have been said to include a lot of things. Now, there's a lot of misconception. There's a lot of argument about nutrition and diet. Are they the same? Are they different? What is a healthy nutrition? How can a healthy nutrition boost a healthy immunity or immune system? We'll start with Dr. Abraham. Dr. Abraham is a public health nutritionist. So, Dr. Abraham, please, we want to get as much as possible from you on this live session.
Oh, thank you very much, George, once again. First and foremost, when we say nutrition, the World Health Organization defines nutrition as the science of food in relation to health. So that means nutrition itself is a science. So, and it must be related to one's health. So that means there is a relationship between nutrition and health. So we must understand that first before we understand the concept of nutrition. So having understood WHO definition of nutrition, then we can quickly look at the concept of nutrition, looking at what a balanced diet should be. But before I tell us what a balanced diet is, let me also quickly define what diet is. Diet is, in a layman's language, is the food that a person eats habitually. Another way to understand what diet means is specific food combination for specific individual based on the person's condition, disease condition, or based on what that diet is tailored to achieve. We may tailor our diet to achieve a specific weight. So you realize that, of course, those that are involved in weight reduction go on specific kind of diets. Or we may tailor our diet based on the disease condition. For example, for those that are hypertensive, you must ensure that there is low salt intake. There's, different kind of combinations. While for those that are diabetic, of course, you must ensure that their diet, combination is in proportion. Because, of course, we know that diabetes is a metabolic disease of protein, fat, and carbohydrates. So, having said that, I am sure that, of course, our listening audience will understand the difference between nutrition and diet.
Yeah.
Then we talk about a balanced diet. A balanced diet is the diet that contains all the essential food factors, the essential food elements that is able to maintain a healthy individual, the healthy condition of an individual. So when we say a balanced diet is a combination of all the essential foods, we are talking about the carbohydrates, the protein, the fats, the minerals, and the vitamins. So all this must be in appropriate proportion for it to be balanced. Suffice to note that a balanced diet is required to be able to maintain the body system.
Yes.
Therefore, anything outside that, if it's low, that means the person is will result into malnutrition.
Nutrition.
Yeah. Suffice to know that malnutrition again can be understood as either under or over.
Yeah.
So if it is over, it's malnutrition, and that can result into obesity, which is a predisposing factor to a lot of this condition. Even in COVID-19, that is the subject today. For patients that are obese, of course, prognosis is very, very poor. Then, when it is under nutrition, it is also malnutrition. That means the food substance, that means the diet does not contain the adequate micro and macronutrients. Again, when we say macronutrients are basically the protein, fat, and carbohydrates, while the micronutrients are basically the minerals and the vitamins. So a combination of a balanced micro and macronutrients that will sustain the body immune system, live a healthy lifestyle, what we call a balanced diet. Thank you very much.
Well, thank you, Dr. Abraham. I actually do not know where to start from, but you've actually touched quite on a few things here that we needed to look at. Yeah, audience, that is what you've just heard. A healthy nutrition. So you have macronutrients, you have micronutrients. So the combination of this is quite essential. So your carbohydrates, your fats, your protein in adequate amounts with your micronutrients like zinc, like vitamin C, like vitamin D, selenium, calcium, and others are quite necessary. And this form your healthy eating plate. So don't forget that. So ADAKU, how can a healthy nutrition boost a healthy immune system? What are your thoughts?
We really need a healthy nutrition to boost our immune system because evidence has also shown that the micronutrients that Dr. AMLOGU talked about, the micronutrients like zinc, selenium, iron, copper, folic acid, and vitamins A, B, C, and E. If you are deficient, if you have any deficiency in any of those micronutrients, it can also alter your immune response. So there has been research done on this, and it's not really hearsay. So we have to be very, very intentional in what we do. As we get our nutrition, our diet from the macronutrients, we should also emphasize on the micronutrients. It's very important. And a poor diet is going to reduce our immune system, and it is going to predispose us and increase our risk of having different kinds of diseases, caused by fungi and bacteria, viruses, and other diseases as well, like long-term conditions as well. And like Dr. AMLOGU said, obesity, I mean, it's a very, very high risk factor for developing cardiovascular disease. And your nutrition, what you eat, can increase that risk of you being overweight or having obesity. So you can see the link between everything and our immunity. So poor nutrition, and that is undernutrition, can lead to malnutrition, where you don't have enough micronutrients and macronutrients. But when you also have in a layman's language, when you also have excess food and you don't exercise and you just eat all the bad fats, the saturated fats, and you take a lot of alcohol and you take a lot of carbohydrate, no protein, you can also increase your weight. You can become overweight or obese, which will in turn affect your immune system. So there has to be a balance in the middle for us to augment our immune system and also live healthy lives.
Wow, thank you, ADAKU. Shortly, there was a question from Shongobi Yadele saying that apart from eating a balanced diet and other food or drug supplements, what other ways can you boost your immune system?
Okay.
Yeah, Dr. Abraham, you want to take that first,
yes.
Then ADAKU can share thoughts.
Yeah. First and foremost, we mentioned earlier on when we talked about the immune system being the soldiers in the body, that is the body defense mechanism. Of course, there is a relationship or interaction between the food you eat, the nutrients, and the development of the immune system. There are specific micronutrients that studies have shown that they have a direct impact in modulating or regulating or in protecting the integrity of the immune system. Now, if you look at the different types of lymphocytes, remember when we mentioned the types of the immune system, where we talked about the leukocyte, the lymphocyte, and so on and so forth. Now, there are specific part of that micronutrients, for example, vitamin D. Studies have shown that vitamin D can maintain the integrity of this immune system. So when you eat a balanced diet and you still want to boost your immune system. It is important for us to note that when you eat a balanced diet, the nutrient, which is the component of this balanced diet, they have specific range. For example, vitamin C. We have what we call daily requirements for all food substances, both the micronutrients and the macronutrients.
Yeah.
I mean, time will not permit us to go into such details. Carbohydrate, we have specific daily requirements. Protein, we have specific daily requirements. Fat, we have specific daily requirements. Vitamins, which we can break down to the fat-soluble vitamins and the water-soluble vitamins. The fat-soluble vitamins are the vitamin A, vitamin D, vitamin E. Water-soluble, we have the vitamin C and vitamin B. All these vitamins that I've mentioned, they have specific values, ranges that is needed daily. Yeah. Once your diet is balanced to meet your daily requirements, you may not need an additional micronutrient to boost your immune system because you have been able to meet the daily requirements. But in specific conditions where you are deficient in some micronutrients, it is recommended that you can boost your immune system through the use of micronutrients. And we have a lot of micronutrients available in market, such that when you see them, of course, you will see the composition of those micronutrients, what they contain. And that is, well, if you remember when I mentioned the definition of nutrition, I said it's a science. So there is a science component of it, whereby we must not exceed, or even if we exceed, we must ensure that we do not our diet does not fall short of what the daily requirement is. But if you need to boost your immune system based on specific disease condition, then you can use micronutrients to boost your immune system, because there are specific micronutrients that studies have shown that they have direct impact on the immune system. Thank you.
Thank you very much, sir. So, ADAKU, would you like to add something? Apart from this balanced diet, what are things in terms of maybe what people need to do, what people need to watch out for, how people need to maybe healthy lifestyle, kind of, even washing of hands, could that actually help us boost an immune system?
Yes, we have a long list of other things that can help us boost our immune system. And there are little things that we can do. And I would encourage everyone to make out time, bring out the effort to do it. I'm doing it myself, so I wouldn't tell you something I'm not doing. So other ways to boost your immunity. Number one, I want to talk about tobacco smoking. In Nigeria, we have a lot of our youths, young people, students in the universities, we have a high population of people that smoke in Nigeria, and smoking actually increases your risk of having different diseases, and it also affects your immunity. So quitting smoking, especially this COVID-19 pandemic period, is so very important. There are different ways to quit smoking. You can use replacement therapies, nicotine replacement therapies, and you can visit your local pharmacy for that. Or if you want any other information, you can ask us later. Then the next thing about nutrition, eating more of fruits and vegetables. You have to exercise regularly, at least 30 minutes a day. Right now, all the gyms are closed in the UK. I don't go to the gym, but I make sure I bring out 30 minutes every day to have a walk, to exercise. It is so very important. I just want to encourage everybody out there, do not wait till you get to your late 30s or early 40s, because just right now, I just want to use myself as an example. I'm having knee pain because I've not been exercising like I used to. So I'm currently doing physiotherapy. So I don't want you to wait till it gets to that stage where you now need physiotherapy to be healthy, or where your knee starts paining you. So right now, ensure you have like 30 minutes walk every day. That is a good form of exercise. Then maintain a healthy weight. Ensure you're not obese. It will help to help your immunity as well. Then alcohol consumption. In developed countries, we have specific units. The public health and the government has advised people to stick to, which is no more than 3 units a day. In Nigeria, I beg your pardon, I don't know what units of alcohol they have, alcohol content we have in our alcoholic beverages. Have we let out our citizens to be just consuming anything they want to consume without telling them what the content of what they're consuming? And whose role is it to advise the general public in Nigeria to look out the alcoholic content of whatever they're taking? Take, for instance, a bottle of beer in Nigeria. If you ask an average Nigerian person, what is the alcoholic content of that bottle of beer? Nobody knows. We have to be intentional about these things. If you're taking alcohol, I don't take alcohol myself, but I advise people, don't take more than 3 units, and you have to work out the unit content, because if you keep taking excessive alcohol at this time, you're predisposing yourself to getting the virus. Then another thing you have to do is to get adequate sleep. 6 to 8 hours of sleep every night. It is very important. These days, people spend a lot of time on their tablets, on their phones, on social media. You have to know when it's time to prepare for sleep, because more than ever, we don't have any cure for coronavirus. We don't have any vaccines at the moment. You have to do what you can do. Get your average, get enough sleep every day. It will help to boost your immunity. Wash your hands frequently. I mean, hand washing is so very important, and keep hydrated. Take at least 8 glasses of water every day. I take a lot of water, and when I say being hydrated, I don't mean just taking sugary drinks, soft drinks, and all that. Make sure you take plain water. Don't go about taking sugary drinks, because it will also increase your risk of having obesity. So stick to plain water. Then always cook your meat thoroughly. And I'm so happy that in Nigeria, we cook our meat thoroughly. We don't eat rare meat in Nigeria. So I'm very, very happy, because some people, some countries, they like eating their meat even when the blood is dripping out of it. So right now, you want to make sure you wash your vegetables before you cook them. And you want to make sure you cook your meat thoroughly till it's well done before you eat it. So very important. And you have to try as much as possible to minimize stress. When you're stressed up and when you have anxiety and depression, it can also make you feel unwell. It can also predispose you to having different diseases or getting infected. So when you're more energetic, when you're more happy, and when you don't have any stress or anxiety or depression, it will also help. So try as much as possible to practice mindfulness. Try as much as possible to try and distress yourself from toxic people, from toxic environments. I've written a lot of articles on how people can stay away from stress and depression. So it is very important as well. So all these things, together with what Dr. AMLOGU has talked about, can help to boost your immune system as well.
Oh, thank you so much, ADAKU. You've touched on so many on the few things I actually wanted to mention towards the end of the program, about healthy lifestyle choices. Like this morning, I've actually done a 1-hour walk, in my neighborhood. Like you said, I don't go to the gym, but I try to keep healthy. It's very, very essential. And
can I quickly add something to what my colleague Adaku just mentioned?
Okay, go on.
I hope that we also answer the question from pharmacist Sheyi Olokun that talked about hydration. It is important for us to note that 60% of adult body, is water.
Okay.
So yes, 60% of adult body contains water. And of course, Pharmacist Adaku mentioned, she mentioned hydration. Which it is also important for us to note that the heart, 73% of the heart contains water. 83% of the lung contains water. 64% of the skin contains water. 79% of the kidney contains water. And 31% of the bone contains water. So what this implies is just like what one of the viewers, Kate, just wrote now, water is life. So the need for us to continue to hydrate our body cannot be overemphasized. Coming down to the topic of today, COVID-19, that affects the lung. So if 83% of the lung contains water, that means COVID-19 patients must be hydrated appropriately in order to reduce the progression of the disease. So I hope that must have answered Sheye's question. Thank you.
Okay, thank you very much. So Sheye Olokun, I hope that has been sorted. What role do appropriate state of hydration play in the management and prevention of coronavirus infection? Yeah, and also Shangobi, I hope you also have had a good one on your question that says, apart from eating a balanced diet and other food and drug supplements, what other ways can you boost your immune system? Yeah, so we actually have touched on that. And I think there's another question that came up. It says, what is the relationship between diet and metabolism? Some people are skinny, yet have very poor diet, eat all the bad fat. Are they also at risk of having COPD and other disease? I'm sure she probably wanted to write COVID-19 or COPD, or does this only apply to obese individuals? So what's the relationship between diet and metabolism? Some people are skinny, yet they have, and have poor diet. They eat all bad fats, and yet they are skinny. Are they also at risk? So what are your views, sir?
Okay.
You want to go first?
Okay.
It's fun.
Yeah.
I'll just say something just quickly before Dr. AMLOGU just says the whole. Let me just say something quickly.
Okay.
I mean, being slim or being thin is not an excuse to eat all the bad fats, because I have done cholesterol tests on patients, and I've seen skinny slim people having a very high cholesterol level, and I've seen obese people having a low cholesterol level. So it's not about body size. There's something we call the body mass index. You need to check your body mass index first of all to know your ideal body weight. You don't just look at somebody, and just say, oh, this person is thin. You have to check your height and your weight. And when you get your body mass index, you can now know. So being skinny and eating all the bad fats is not going to save you. Your cholesterol level will go up, and it can also increase your risk of having cardiovascular disease. So I just wanted to point that out quickly.
Yeah, thank you very much. That is also essential. BMI, is very important. Your weight is very, very essential in all this. In all of these, guys, your weight is very, very essential. Are you overweight? Are you obese? So you need to check, your local pharmacies, pop in there. It's free. Pharmacy, pharmacy stores or community pharmacies are the first point of call that you can actually go into in England. And I'm sure all around the world, wherever you're watching us, get into your local pharmacy store and ask them about body mass index. They will tell you. It is called BMI. So it's what they do is that they look at your height, they look at your weight, and they actually be able to tell you what it is. It is very essential for you, whether you are thin. Your cholesterol is also very important. What is your total cholesterol level? Do you have an idea what it is? Because these are predisposing factors that a lot of us actually overlook. We tend to not bother about some of these things. So check with your pharmacies. Check with your pharmacies. Your pharmacies are there for a reason. That is why they are called your community pharmacy, so they can attend to you. If you've got friends, Pharmahealthtalk will provide a lot of information. ADAKU also runs, health and well-being session on Facebook. So contact any of these guys. Contact me. Contact any of these guys, and let us, help you out in, increasing, your health awareness. Yeah. So, Dr. Abraham, you were going to say something about that question.
Yes. First and foremost, let me quickly let the audience understand that there's what we call the basal metabolic rate. When we say basal metabolic rate, it is just telling us the intake of energy and the expenditure. So when you take in your calorie and the amount of energy intake, if it is not commensurate with the amount of energy that is being expended, then it is likely that that person will become obese. Now, looking at diet and metabolism, for individuals that are living a sedentary lifestyle, of course, the basal metabolic rate will be reduced. Whereby for those that are very active, like the adolescents, or for those that are involved in hard labor, like all these skilled workers that are involved in like all these carpenter, mason, all, yes, exactly. I mean, those kind of jobs. Do you understand? So their own basal metabolic rate, of course, is higher because they expend more energy. So what we're trying to say in essence is, if you taking a lot of calories and you don't expend it, that's likelihood that, of course, you'll be obese is there. That's one. Yeah. Secondly, we have specific figures. For an average male person, your daily energy requirement is about 2,500 kilocalories per day. Female is about 2,000 kilocalories per day. For the geriatric patient, because of their because of their intestinal motility and and other factors, theirs can be reduced to 1,600 per day. So what I was saying in essence, you will not expect that the basal metabolic rate for somebody that is just an office executive, gets into an air-conditioned car in the morning, gets into the office, sit down all through the working hours, right? Take all the junks, food, and so on and so forth. You will not expect that person's basal metabolic rate to be the same as an athlete or somebody that is involved in regular exercise.
Sure.
Do you understand? So, so the person that asked this question, so regardless whether the person is thin or fat or whatever, what we are saying is the basal metabolic rate is really a function of the metabolism of the metabolism of the diet that person is actively taking. So, and that takes us back to what we said earlier on in terms of diet, because diet is specific. Nutrition is holistic because we're talking about the science of food and its relation to earth. But diet, in this case, we're talking about specific, individual, what you take in to give you that number of kilocal per day. Yes. And that will, based on the lifestyle of that person, that now determines the basal metabolic rate. Thank you.
Yeah.
Thank you very much, guys. I'm really, really, really excited that this is actually coming on and people are asking questions, and we're able to provide information. So, guys, in a nutshell, a healthy diet, looking at the healthy plate, you're looking at fruits, vegetables, whole grains, nuts, moderate consumption of fish, dairy foods, poultry, limited intake of red and processed meat, refined carbohydrates, and limited sugars. So a diet that will provide appropriate amounts of healthy macronutrients and essential minerals and vitamins, which are called the micronutrients. Somebody asked, what is micronutrients? So micronutrients are such as supplements such as vitamins, minerals, zinc, vitamin D, vitamin C, different from the macronutrients, which is essentially carbohydrates, protein, and fat. So I hope we've been able to touch that question as well. So we're moving on. Thank you so much, guys. And for our audience that are joining, thank you for joining. This is Pharma Health Talk live session with Dr. Abraham AMLOGU, a clinical pharmacist and a public health nutritionist, and also ADAKU EFURIBE, clinical pharmacist and an independent pharmacist prescriber. And I'm the host, George. I'm a pharmacist. I also am the host to Pharma Health Talk and convener of Pharma Health Talk. So we're moving on. Medications, drugs, and immune system. As custodians of drugs and experts of drugs. Yeah, this is what we do. People know us for talking about drugs, but over time, we've moved on from drugs. We're also now public health nutritionists, clinical independent pharmacist, prescriber, clinical pharmacist. So we're doing all sorts, apart from. So the knowledge, 20 years experience of drugs, man, that is a lot of time. So we're experts of drugs. And so how would you describe drug nutrient depletion and their effect on immune system? So drug nutrient depletion is actually, they're quite common, either by, either passively or actively. Passively in the sense that a lot of people don't even know. People use antibiotics indiscriminately, buy it over the counter, Bicham 500, they get it from the community pharmacy store, boom, 3 days, they walk away, come back maybe on the 4th day, buy another one. So there could be possibility that these drugs are actually depleting their nutrients. Now, nutrient depletion can also be as a result of long-term medication use, which interfere with a normal process of nutrients absorption, or due to some chemical interaction within the body that affects nutrition in the body tissues. Nutrient depletion can also cause major health problems, including impaired immunity, depression, anxiety, muscle cramps, blood clots in certain cases. Now, looking at all the drugs that we have, or some of the drugs that are common, antibiotics, antacids that we buy over the counter, what else? Vitamins, supplements, a lot of things, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, aspirin. So how would you describe drug nutrient depletion and their effect on immune system? We'll go with Dr. Abraham.
Thank you very much, George. Let me just quickly add to the definition of micronutrient before we go to drug nutrient depletion.
Okay.
It is important for us to note that micronutrients, from the word micro, that means they are required in small amounts. Some authors call it trace elements. So they are required in small amounts. However, their usefulness in the body cannot be overemphasized because they tend to improve the immune system of the individual. Having said that, if we take a look at drug nutrient depletion, that is actually taken from the broader perspective of drug-food interaction. Now, when we say drug-food interaction generally means anything whatsoever that you combine with your medication that will affect the therapeutic effect of the drug. In other words, it will reduce the plasma concentration of your medication. Thereby, the medication cannot elicit the therapeutic effect or the desired effect. So, combining your food that contains the nutrients with your medication, there must be a need for clinical assessment and the healthcare practitioner that will understand that those combinations of the combination of a specific food and a specific drug based on the disease condition that the patient is, the health practitioner is managing, that both cannot be prescribed together, or even if they are prescribed together, there must be specific time intervals. For example, antacid. You have a patient that is coming with hyperacidity, and that same patient with hyperacidity, right, is being managed for some other disease condition. So you must be able to educate the patient on the time intervals. So for antacid, there must be minimum 1 hour interval between when the patient is taking the medication and when the patient is taking the food. So otherwise, either the drug affects the food or the food affects the drug. Permit me to also let us understand what the father of medicine said, Hippocrates. He said, "Let food be thy medicine, and let medicine be thy food."
Be thy food.
So for a lot of us that have not come to realize or to accept the fact that food is actually medicine, it's a very serious matter. So we must understand that food is medicine. So there is a serious interaction whereby if specific nutrients are given together with some medications. So we have different conditions ranging from hypertension, diabetes. I mean, you are managing rheumatoid arthritis, you are managing different kind of disease conditions. So there are specific micronutrients or nutrients that should not be combined with those medications. Otherwise, the effect, the desired effect that you expect from the medication will not be achieved. Thank you very much.
Yeah, ADAKU. Yeah, your perception. What are your thoughts? Yeah.
Well, Dr. AMLOGU has said it all, but I just want to add that, during that heat of the moment where, when we had this coronavirus pandemic and it was, in Nigeria, and everyone was sending WhatsApp message about herbs, spices, and all that, I had to release the video. I mean, it was very, very important that I did that, because in all the videos that I got from through WhatsApp, and all those videos came from elderly relatives, like 70 and above, and I knew they were taking certain medicines. And alarm bells started ringing because nobody offered any information about drug-food interaction in all those videos. So we just have to be very careful, especially if we take medicines for long-term conditions. Some of those spices, those herbs, and some of the food we eat interact with our medicines. A very classical example is grapefruit juice. Grapefruit is in this citrus family. It's not orange, it's grapefruit, and we have a lot of it in Nigeria. Grapefruit interacts with a lot of antihypertensives, so we have to always speak to our local pharmacist. You don't have to abuse drugs or keep on buying drugs over the counter, especially pain medicines. Common pain medicines classified under NSAIDs, medicines like aspirin and ibuprofen, some of those things can also have detrimental effects in your body. And things like ibuprofen, you must not take them without food in your tummy because it can lead to ulcer. So some of the drugs, interact, and there is drug nutrient depletion. Things like antibiotics, we've talked about it. It can affect the calcium, magnesium, vitamin B, and folic acid level in your body. It can reduce the level of those micronutrients. So when you're on long-term antibiotics, you might be having some form of deficiency around those supplements. Then antacids, like we've talked about, like antacids like ranitidine can deplete your calcium and folic acid level as well. Other drugs like hydroxychloroquine. When people were talking about hydroxychloroquine, about it with the COVID problem, a lot of people were already going to their pharmacy to ask for it without even prescription in Nigeria. It can deplete your calcium and vitamin D levels. We are battling with COVID-19, and we want to build up our immunity to be able to fight the virus. So please, please, please do not go and buy medicines without prescription, without having your pharmacist's advice. You'll be taking those medicines, you don't have the virus, and yet you are depleting even the little micronutrients that you have that could help you even fight the virus if you eventually get it. So we have to be very, very careful. I know we have patent medicine dealers in Nigeria, and we also have registered pharmacists and pharmacists. So before you take any medicine, especially for long term, before you just go there and buy things and be taken, or when you have all these WhatsApp video messages coming in, you have to check with your pharmacist, walk into your local pharmacy. I also run like a weekly drug information service. You can ask me, but I don't know how many people I can reach. We have so many pharmacists in Nigeria. We have so many pharmacists in the UK. So link yourself with a local pharmacy and link yourself with a pharmacist you can always check with. You can also check with your doctor as well. So make sure you get medical intervention, medical advice on the drugs that you're taking, because it's going to affect your immunity and it could deplete the nutrients in your body. Yeah.
Okay, thank you so much, guys. That's quite wonderful. I think there was a question. It says, is it good to use all these vitamins like vitamin C, D, and E as self-medication? What are your thoughts? Well, vitamin C is a cofactor for many enzymes It enhances, it's an antioxidant, limiting inflammation and also helping in tissue damage. You know, while growing up, I'm sure a lot of us were given vitamin C because of that name. That was the first name I actually understood, Scovry. You know, Scovry, that, oh,
Yeah.
take vitamin C to prevent Scovry, you know. So
Yeah.
we were popping vitamin C when we were younger. So yeah, vitamin C is good. From my own perspective, yeah, vitamin C is good. It is soluble, and you can get them from fruits as well if you don't want to actually buy them. And that is why it is essential that your nutrients, your food, your healthy diet contains fruits and vegetables, because these are natural places that you can actually get these, micronutrients from. So fruits and vegetables, they are very, very essential that you have them as part of your healthy eating plate. I think vitamin D. Yeah, vitamin D also, as there's been a lot of studies, clinical trials to actually find out, what is the connection between vitamin D and COVID. And I think in the wake of the pandemic, a lot of people said they use vitamin D in addition with zinc and some other stuff to help them, fight COVID. Well, to be honest, as a pharmacist and scientist, we only can rely on evidences, clinical evidences. So it is not whether one person out of 7 billion people in the world that use them and it worked for them is going to work for the whole entire population. So, guys, what are your thoughts? Is it good to use all this as self-medication, vitamin C, D, and E? ADAKU, you want to go first?
Well, at the moment, like I said before, if you're taking any medicines for long term, for a long term condition, for instance, you have hypertension, you have diabetes, double check with your doctor, double check with your pharmacist before you start taking any supplements. Otherwise, you really need to start taking some supplements. I've been taking supplements for since March right now, and it is really needed. One thing I just want to mention is because we live in tropical regions, we have a lot of sun, and we believe that, we have a lot of vitamin D in our system. Evidence and research has shown that Black and Afro-Caribbean people have a risk of having low vitamin D levels. I've had this argument with people all the time. They tell me, we have a lot of sun in Nigeria. But have you ever done your vitamin D blood test? Go and have your vitamin D level checked in the lab. You'll be alarmed. So you need to have this blood test at least once in a year. You have to have your routine blood tests once in a year. You can speak to your doctor about it, speak to your pharmacist about it. And if your vitamin D level is low, you'll be prescribed some vitamin D to take. And to maintain healthy bones as well, which is very essential at this time, you have to have a calcium-rich diet, good sun exposure, and regular activity. So in a nutshell, taking vitamins is good. At least even if you don't know what to take, you can take the multivitamin supplement. But before you take any supplement, like I said, especially if you're taking other medicines as well, or if you have any long-term condition, check with your pharmacist and check with your doctor. But I would advise people to take vitamins, especially in this COVID-19 pandemic period, but double check. Especially, one thing I also want to mention is women that are breastfeeding and pregnant women should always speak to their pharmacist before they take any medicine, because if you're pregnant, anything you take can be transferred to your baby in your womb. So you just have to be careful, before you take any supplements as well.
Okay. Thank you very much, Dr. Abi. Is there anything you'd like to shed light on more on this regular use of vitamin supplements? Because that is actually, so we'll just keep that, because what is the role of supplements and vitamins in building our immune system? That is actually meant to be the next thing that we're talking about. But if we can integrate that into our talk now, then we'll move on to, maybe some other questions and other stuff to talk about.
Yeah, thank you very much, our host and Pharmacist ADAKU, for what you just shared now. Let me just add that there are basically 2 reasons why vitamins or micronutrients are essential in the body. One, It's either we are augmenting what is deficient in the management of specific disease condition. In other words, we are managing a patient that is deficient in specific micronutrients. So it's very reasonable to prescribe any of the micronutrients in order for to benefit the patient. The second reason why we take micronutrients is to maintain the immune system. It is important to note that either you are taking it as, to augment your management, the management of a patient, or you are taking it to maintain your immune system. It is important to note that there are values and figures and dosages attached to the use of these micronutrients. When you take micronutrients or vitamins above the recommended daily intake, the excess may not be harmful to the body, but it is important to know that they will not. It will be of no benefit to the body. That's one. Secondly, most of these micronutrients or these multivitamins are very expensive. We're not trying to discourage the use of the micronutrients or the vitamins, but you must tailor it to a specific need in order to be able to get the maximum benefit on the usage. When we take micronutrients without specific need, it is of no benefit to the body. And it is important for us to note that all these micronutrients are available in our diet. But in a situation whereby you live in an environment where there is poverty, uncertainty, and of course, you are not sure, even what we call balanced diet, if we do what they call food analysis, a lot of the vitamins and minerals contained in an average balanced diet, you find that most of these micronutrients have been denatured.
Yeah.
If you look at the sources of these minerals and vitamins, either from the meat, from fish, from green vegetables, and so on and so forth. But sometimes the process of making it into our diet is such that the micronutrient content is eroded. So even when you take what you assume to be a balanced diet, you are not getting the maximum benefit of the micronutrient that is desired in the body. So the need for supplements at this point becomes imperative. So what I was saying in essence, you could use micronutrients or multivitamins and so on and so forth. But if you can be objective and you have that assurance of the quantity of the quantity or the amount of micronutrients from your balanced diet for maintaining the immune system for an healthy individual, there may be no need for a supplement. Thank you.
Yeah, thank you very much, Dr. Abraham and ADAKU. Yeah, this is really, really interesting. So in a nutshell, what I've actually put down in all of this is that vitamins and mineral supplements may help us fill nutritional gaps. And studies have shown that, vitamin supplementation can improve immune responses. Now, the caveat is where we have low-income households, people just like Dr. AMLOGU mentioned, people who actually cannot maintain a healthy, balanced diet. Now, they can actually supplement pregnancy and lactating women, just like ADAKU mentioned, but make sure that you speak to your pharmacist or your doctor. And can I also add this, that this live session is actually not to treat. We're actually raising awareness. We're actually promoting health. And what we're dishing out tonight is actually information on how to build your immune system. So this does not override any plan by your healthcare professional that has been in place with your disease condition, please always check with your doctor. So infants, toddlers, and the critically ill people can also supplement based on recommendation by their doctors. And also mega doses of supplements. Mega doses of supplements do not really appear justified. There are no clinical evidences to back that taking 2 grams of vitamin C will help immune system. But, you know, just like I tell people, moderation is good. So, and even sometimes it can be harmful, you know, and even suppress your immune system. So please do not overdose on vitamins and supplements. And even herbal supplements. There are quite a few herbal supplements. If you're out there, if you're on a long-term disease condition, please check with your pharmacist. They will be able to help you on interactions with some of these supplements. Is it Saint Watts or something? Ginkgo biloba.
St. John's wort.
Yeah, St. John's wort has actually, you know, been documented to affect quite a lot of drugs. So please ensure that you're checking with your doctors. So guys, I've got a few questions here before we run. Now, Seyi Olokun said the importance of health promotion and health education, and education cannot be overemphasized in this COVID pandemic and most other public health challenges. How can pharmacists contribute to a reduction in the mortality and morbidity of these challenges? And I think this is one of the platforms that we're doing, Seyi Olokun. This is one of the things that we have identified to actually, as pharmacists, to let our voices out there, to help our community, to help people around us, to help, you know, people who we're connected with, to actually, you know, join us, participate, engage as we promote health. So this is one of the ways that pharmacists can actually do it, you know, and I encourage every pharmacist out there, every healthcare professional, if you're a nurse, if you're a doctor, yeah, this, you know, let's collaborate, let's do this together, let's dish out information to people. That is the only thing that we can actually give back to our community. It's not the money, but we can actually dish information. You know, we're quite versed, we're quite experienced, and we're quite knowledgeable about the things that we do. So Dr. AMLOGU is a clinical pharmacist, you know, in Aso Villa. So guys, if you're in Nigeria, you know, that's the guy to link with, and other pharmacists as well that are watching this. ADAKU EFURIBE is a clinical pharmacist and an independent prescriber. So that is like a doctor looking after you. She's a pharmacist and she's also an independent prescriber. If you check that out, you know what it means to be an independent prescriber. So we have a lot of platforms. ADAKU is also running Ask ADAKU, you know, on Facebook, on social media platform. You know, so there are quite a few other things that we're doing that pharmacists can do to help support the community where they practice. Health education is vital in prevention of antibiotic misuse and overuse. This will help prevent our antibiotics for when they are needed and also prevent resistant bacteria. Yeah, thank you very much, Seyi Olokun. I'm just checking because of time. I think Dr. AMLOGU has to run to some place. Now, do you get the same benefits when you take vitamin C rather than getting it from natural fruits? That is from Iboje, Big Boss. So please, do you have anything to say on that, sir?
Okay, thank you very much. First and foremost, vitamin C from fruits is from the natural source. Why vitamin C you get from over the counter are synthetic vitamin C. Now, there is a study on the variation between the natural product and the synthetic product. Now, you get more vitamin C because the bioavailability of the natural product, which is the one you get from the fruit, is more than the bioavailability of the vitamin C you get from the synthetic product.
Yep.
But again, how do you quantify if for synthetic products, each tablet of vitamin C comes in 100 milligrams? How do you know the quantity of vitamin C that we fill a glass cup of water to? How do you know the quantity of vitamin C in that content?
Yeah.
It's a problem. However, it is important for us to note that the content of micronutrients that you get from natural products is far more than what you get from synthetic products.
Yeah.
Thank you.
Thank you very much, sir. ADAKU, you have something to say about that?
No, I was just nodding. You were saying, yeah. So that's it, yeah.
Good. That's good. Yeah. So, guys, I think our next session is actually lifestyle choices and immune system. We have touched on some of these things before. What are the common lifestyle choices people can make that actually can affect their immune system? Things like sleep, quality of sleep. You mentioned it before. Alcohol consumption, management of stress. I think you mentioned that. So, are there any other ways that people actually can improve on their immune system through lifestyle choices? Dr. AMLOGU?
Yeah, thank you very much, George. First and foremost, before I say something on lifestyle, let me quickly just give us a pictorial representation of health, where we see health as a triangular base with health on the apex, and on the base of the triangle, we have what we call the habit and the habitat. In the middle of the triangle is what I call the genetic component that you and I, we can't do anything about it for now. But of course, with innovation in modern science, something is being done. So hopefully we'll get there. Having said that, when you look at the components, the three components of health, looking at health at the apex of the triangle and habit and habitat at the base. So the totality of our health is centered around these three components. So your habits, that is your lifestyle, predisposes you to chronic diseases such as hypertension, diabetes, etc. Whereby your habitat predisposes you to infectious diseases such as malaria, typhoid, just name them. So having said that, right, coming back to the component of the lifestyle, which is more of the habit that is a predisposing factor to some of these chronic diseases.
Yes.
So your lifestyle, if you look at the definition of diabetes, what did it say? It said it's a metabolic disease of what? Carbohydrate, fat, protein. Of course, you can also go into the differentials of type 1 and type 2. But for the type 2, we know in specific terms that, of course, moderation in your moderation in your lifestyle, right, will prevent you from becoming diabetic. Studies have shown that children, of course, studies have shown that children, that are obese in early stage of life that are obese in the early stage of life are prone to become diabetic in later life. So if the lifestyle of an individual, it's not in moderation in terms of preventing specific disease condition, we know that smoking is a predisposing factor to a lot of disease conditions, hypertension, strokes, and so on and so forth. We know that reduction in salt intake can reduce the rate of hypertension. We know that certain food or certain kinds of lifestyle can predispose an individual to rheumatoid arthritis. Yes. So once you have an idea of what your lifestyle of a specific disease condition is all about, you can tailor your management. So, and of course, in clinical practice, we have what we call the non-pharmacological management of specific disease condition. When we say non-pharmacological, we mean the non-use of drugs. So if you are managing a specific disease condition with drugs alone, I can assure you that you cannot get the best of results. But a combination of the non-pharmacological and the pharmacological component gives you an holistic approach in the management of specific disease condition. Therefore, your lifestyle is key in ensuring that you are able to manage that condition effectively. Thank you.
Thank you very much, Dr. AMLOGU. that analogy actually fits into, you know, whatever we've been talking about today. So health as holistic, we have our habits, we have our habitat, and the genetic makeup. Most of the non-communicable disease, like WHO has always prescribed, has to do with our lifestyle. So what are the habits? What are the habits? You know, smoking, you know, personal hygiene, even in this COVID-19. I mean, that is one of the treatments. Wash your hands before cooking, wash your hands after now and again. You know, if you can't get access to water and soap, use hand sanitizers. So lifestyle, to be honest, is a bedrock of our health. You know, ADAKU, you want to share some more thoughts?
Yeah, I just want to just share a little bit of things. At the moment, we have some patients that are pre-diabetes. That means their blood sugar level is high, but it's not so high at the moment. So I just want to, you know, talk more about lifestyle and the benefits, just like Dr. AMLOGU has said. Sometimes we overlook lifestyle modification and we just want the medicine, we want the drugs. Every week, I share articles about non-drug measures to treat certain things or to help you go through stress and things like that. So about the pre-diabetic patients, we are managing them with exercise and healthy eating, and it's working. Some of them eventually don't go on to have full-blown diabetes. They just get managed and they are no longer diabetic. Yep. Then the second class of patients I've been managing are patients who have high cholesterol level. Some patients don't want to take statin tablets, which are tablets that help to reduce the cholesterol in their bloodstream. Some patients cannot tolerate statins because of the side effects. So some of those patients tell me, I don't want to take statin. And I manage them with lifestyle. You know, we talk about their diet, we talk about alcohol consumption and exercise. And after 6 months, we check the cholesterol level, and some of those patients have been able to reduce their cholesterol level to their normal level. So we keep monitoring them. Some of them don't take statins at all. Some of them don't take medication at all. So lifestyle is very important. These days, we have a lot of people who are going through sedentary lifestyles, which is sitting down. There's a lot of sitting down, especially with this pandemic period. People are working from home. Yeah. I'm a good example of someone who has been working from home for a few months now, and I'm beginning to see the effects of working from home on my knees. Like I said, I used to go to the gym like twice a week, and I've not been doing that. But right now, it's I have to use physiotherapy to exercise my knees because I'm beginning to feel some pain. And I've been told the more I move about, the more I engage in physical activity, the pain will eventually go. But it's a very long process. So I'm just advising everyone out there listening to us, take your lifestyle modification, take your lifestyle advice very, very seriously. Your exercise, your diet, keeping hydrated, staying off from stress. Sometimes deactivate yourself from social media. Sometimes I don't even watch CNN. I don't watch the news. Sometimes I just switch off from TV. I don't watch any television. I just spend some time. You need your time for your meditation. You need your time for your mindfulness. You need your time for your spiritual growth. You just need those time. Just create that time for yourself and engage in self-care. In as much as we are pharmacists, we're out there to help you. We're out there to give you drugs. We're out there to prescribe drugs. We also want you to take ownership of your own life. We also want you to be a partner. It's called patient-centered care, integrated healthcare, where the patient is also a partner in the decision-making around their lives. It's not just the doctor or the pharmacist or the nurse. You are also involved in your own care. You can tell the doctors what you want, or you can ask them about different options. It's not a one pill cures everything. So there are things you can do to also help yourself to live longer and to live, a healthy, happier life.
Yeah, thank you so much, ADAKU. Thank you so much, Dr. AMLOGU. So on here, I've actually put these points down: lifestyle choices and immune system. Good hygiene, such as washing hands regularly, covering your mouth and nose with tissues if you're coughing. So you're protecting yourselves, you're protecting others. And also when you have a wound, try to wrap it up. In that way, you're actually preventing infection, and that could affect your immune system. Now, vaccination. Now, guys, we cannot run away from vaccination. Like Dr. Abraham mentioned before, about immune system, about immunity. Now, there's something we call acquired or adaptive immune system. Now, until when we get inoculated, we can actually not respond to this disease. So vaccination is important. Flu vaccination, if you're at risk and if you're a frontline worker, please don't over spiritualize it. I know that a lot of talk has been going on about vaccination, about all that, but I can tell you that vaccination is quite important, especially in this period that we have the pandemic. This is a disease, a viral disease. There's no cure yet, and the only possible cure is vaccine. And even the government is saying that this vaccine might not come even until spring. So guys, it's in your hands. So food safety, when you cook food, make sure that you wash those foods, make sure that you wash your fruits, make sure that you wash your hands before you start cooking. Make sure that the chopping board that you use in preparing raw meats, you actually don't put cooked meat on it. Make sure you wash them properly. Make sure you actually hydrate yourself properly. Drinking enough water. Dr. Abraham has told us about the significance of taking adequate amount of water. Now, safe sex is actually very important. Ensure that, because HIV, AIDS is still out there, gonorrhea, syphilis, they are still all out there. So these are things that actually can damage your immune system. So quality sleep, the quality of sleep that you get actually helps. Alcohol, do everything in moderation. Don't drink alcohol excessively. Physical activity, ADAKU has mentioned it, engage in some form of physical activity. If you can do 1 hour, do 30 minutes around your neighborhood. Now, weight management, ADAKU talked about BMI before, body mass index. Check with your pharmacist. Tell them about yourself, about your health, and they'll be able to help you. Weight management programs, there are quite a few community pharmacies, your local pharmacies that are actually offering free weight management loss program. So check with your local pharmacist. And also stress management, manage your stress. I know in these difficult times, it's quite terrible. Financial stress, marital stress, family stress, everything all coming together, spiritual stress, health stress. There's really nothing that is not stressful these days, but take time, just like ADAKU said, disconnect sometimes to connect, if you know what I mean. So manage your mind, manage your stress, and your immune system will be boosted. Yeah, thank you very, very much, everyone that has connected, everyone that has joined. So last, Dr. AMLOGU, is there anything you want to share now before we wrap up this program?
Yeah, thank you very much, George. COVID-19 is real.
Yep.
Let us stay safe. For now, no drug, no vaccine. What we are advocating right now is, or what we are preaching right now is prevention. Prevention, prevention. That is key. Thank you very much, George, our host. Thank you, ADAKU. See you again. Bye.
Thank you very much, Dr. AMLOGU. ADAKU, is there anything you want to add before we wrap up?
I just want to say thank you for having me today, and thank you, George, for organizing this very important health talk. And thank you, Dr. AMLOGU, for all your contributions. I will be listening to this thing over again. And, I enjoyed the talk about immunity, macronutrients, and nutrition and diet. I had to know the difference between nutrition and diet. So even when I'm talking to my audience, I can differentiate. Yeah. So thank you for everything. And I just want to encourage everyone to always wear your mask, always carry your hand sanitizer. I have my hand sanitizer almost in all my handbags, because I can just take this handbag and forget about it. I know men, it's easier for men. They don't go around with handbags. So women, keep your hand sanitizers where you would not forget them, and always wear your mask, and please stay safe and stay healthy.
Thank you so much. Now, closing, the essence of this event on Pharmahealthtalk live session, guys, is to promote and increase awareness on healthy eating, healthy lifestyle, and to support and bring awareness and give you more information about boosting your immune system. I hope we've been able to touch on so many of the questions that you've asked. I hope we've been able to meet your expectations. So healthy eating, if diet is not readily accessible, supplement with vitamins, and aim for good quality sleep between 7 to 9 hours and also protect yourself and others, maintain social distance, get a flu shot, and have a review of your medication with your doctors or your pharmacist for optimal outcome. So it's me, George Orisile, the host for Pharma Health Talk. Thank you, Dr. Abraham AMLOGU, for actually coming onto this, and ADAKU EFURIBE. Thank you so much. Now, together, as men of honor, we
join hands.
Join hands. So thank you so much. I'm really excited. I hope our audience out there are really excited about this, and we hope to bring this more onto your, onto your platform, onto your view next time. Thank you, and God bless. Bye-bye.
Bye.
Bye.